Good evening, everyone. This is John Juliana. We welcome you to tonight's webinar. Joining me tonight is Dr. Alan Bass, and together we're going to discuss how to invest in your practice and really work smarter, not harder. We're going to be talking a lot tonight about revenue cycle management. Listen-only mode. It doesn't mean that you don't have the opportunity to ask questions. Please ask questions anytime by typing them into your GoToWebinar pane on the right-hand side of your screen. We'll address all of those questions. Also, this webinar is being recorded, as we always do. So everybody who is registered is going to get a recording of tonight's webinar in case you want to go back and reflect upon that at a later date. So as I said, we're going to really talk tonight about some of the components of revenue cycle management. We're going to talk about some of the benchmarks to determine whether or not your billing department within your practice is actually a strength or is it a weakness. And before I get started, let me just talk a little bit about this whole concept of outsourcing your billing. I'm a very strong advocate of outsourcing certain processes within a practice that might be and could be done better by true experts who have nothing other than that process in their hands. In our practice today, we have so many things that we need to focus on. We have patient care, we have regulatory issues, and the complexity of medical billing has gotten so intense that this now becomes another process that we should indeed think strongly about outsourcing. Much like we don't attempt to do our accounting, we don't attempt to do our legal work ourselves, we don't attempt to do our HIPAA compliance, we outsource those things to experts. And the reason we outsource is simply for the specialization of labor. When somebody does only one thing, they tend to do it much better than when you're doing a multitude of things. We also outsource because it provides us with the flexibility of labor. Think about your billing department, and if you have two billers working for you and one of them goes out sick, the production of your revenue cycle management is literally cut in half. That's a frightening scenario. With outsourcing, you gain lots of flexibility of labor because NEMO billing works in teams that easily take over. There's also the ability to concentrate on your core expertise, your core business expertise. When you outsource, that lets you focus on patient care and revenue generating opportunities that you're currently missing because you're focusing on the complexities of billing. It also allows you a better handle on the regulations that are becoming astronomical as it applies to revenue cycle management. You may have heard that Medicare and other carriers are now using target audits that are putting a lot of us under the microscope. When you outsource your billing to NEMO billing, we have a critical way of looking at revenue cycle management, and you're guided through the process that keeps you safer from audits. We, for example, analyze your practice monthly and demonstrate to you areas not only where you may be weak, but where there might be potential threats of audits for you. So you sleep well at night knowing that you're well within the bell curve that will prevent you from, or at least lessen the possibility of audits. It also reduces your operational costs and your recruitment costs. Many of us underestimate how much it truly costs us to do billing within our own practice. Many times I'll ask a doctor, What is it costing you to do billing within your practice? And the doctor will simply reference the payroll of the biller, but it goes far beyond that. When economists truly allocate costs to a department, you have to consider not just the payroll of that department and the benefits of that department, but all of the resources that go into that department. For example, the technology they use, the computers they use, the expense of training that department and ongoing training, since billing is and coding is constantly changing. It takes into consideration even the details such as the square footage of the office that that department occupies. The reason you utilize that type of technique when you allocate costs is because one of the things that are often underestimated is the opportunity costs. An opportunity cost is the cost of an alternative foregone. If you invest in something, it's not just the cost of investing in something, it's also what you lose by not investing in its alternative. So you always have to look and add the opportunity cost. For billing, if we're focused on billing and we're focusing on the complexities of billing, it's not only the risk of coding and audits, but it's also the fact that you can't be focusing on other areas of your practice. That's why outsourcing makes so much sense. Indeed, when I do an analysis of a practice, I often find that billing in-house costs as much as 10 to 12% for the average podiatry practice, 10 to 12% of the practice's collection. You could outsource for far less than that and have all of the expertise and labor flexibility and reduction of opportunity costs associated with that decision. So it makes perfect sense. It's why we outsource other things, and it's why many, many businesses are outsourcing business processes regularly. Before you do it, I think you owe it to yourself to ask some due diligence questions and make comparisons of billing companies. We pride ourselves on very strong points of differentiation when you outsource to NEMO billing, because it's done right through your TrackNet database. It comes with a whole host of advantages, not the least of which we understand podiatry like no other billing company. But you have to ask these questions. Alan, I'm going to ask you to go over some of those due diligence questions, but keep in mind as we go through this that when you're comparing billing companies, sometimes it's not even as simple as comparing apples to oranges. Sometimes it's like comparing apples to bowling balls. It's so different. So, Alan, I'll advance the slides for you, but please go through some of the things that these folks have to think about and ask as they compare billing companies.
Sure. Well, good evening, everyone, and thank you, John. As John said, when you look and evaluate what a billing company does for you, you have to think beyond just the processing of the claim. A lot of people think, okay, I'm going to finish what I'm doing. I'm going to send a super bill to another company, and they're going to get that claim paid for me. Well, what you need to think is beyond that. What are the other things that they're doing for me? What are the functions are they doing for me? Because to be very honest, anybody could push a button. Anybody can push claims from their own system out to an insurance company and attempt to get them paid. But you have to think beyond that and think about what's going to happen if and when claims don't get paid, and what's going to happen for all the other things that go on in the revenue cycle. Next slide, John.
Sure. And Alan, I'll add, if I may, to your point that some billing companies will simply submit the claim and maybe post a payment. Other companies will just submit a claim. the difference between a complete revenue cycle, and if we look at what the revenue cycle entails, it entails scrubbing the claim, submitting the claim, having the claim adjudicated, appealing the claim if it's any part of it is denied, posting the payments of the claim, and then sending out patient statements for patient responsible. That's the complete revenue cycle. NEMO billing, we do that entire cycle. Other companies could easily price less, perhaps, maybe not, but they're not doing the complete revenue cycle. So please make sure that you understand what's included, what's not included.
Sure. And to John's point, thanks, John. And to John's point, that's the comparison of apples to bowling balls. Because if a company is only going to do that one thing, or you have a company that does the full revenue cycle, that's what sets those companies apart. You know, John and I were actually today at a conference, and I was speaking with somebody, and this exact topic came up about low-hanging fruit. And the doctor was concerned because he felt that, well, my billing company is getting me all this easy money, but he's concerned about all the other things that might be a little bit more difficult. You know, a lot of things that we do in podiatry sometimes are pretty straightforward when we talk about at-risk foot care and straightforward E&M visits without modifiers. A lot of that is a very easy process to get done, and that's very low-hanging fruit. And a lot of your billing companies would be able to go out there and get this money for you. It's what goes on after that low-hanging fruit. What are they going to do in order to get the money that's a little bit more difficult? And making sure that there are certain processes in place to get that low-hanging fruit and getting that extra money or the money that's due to you, it's even more important. Next one, John. So time is money. What's very important about that is one thing that John spoke about just a minute or so ago. When performing your billing for yourself in TrackNet and having NEMO billing do all the billing for you, there's no transfer of data. Everything that NEMO billing does is right within your own TrackNet billing system. Everything is completely transparent. You know, a lot of times I talk to doctors and they say, well, I take my super bill and I mark off what I did and I take it as a batch and I fax it over to my billing company and they process it there. Well, what's the biggest problem with that? Number one, that takes a lot of time. Just getting all that together and getting that data over to your billing company, because then what goes on beyond that? More time, because they then have to take all that information and put it into their system. All along, that's wasted time. That's time that can be converted into money. So what I'm trying to say is everything that's done in TrackNet is transparent to you. You put your information into TrackNet, and then that's when NEMO billing takes over. After you put in your CPT codes and your ICD-10 codes from your electronic super bill, our billing team then takes over and goes through the entire revenue cycle management right then and there in your system. We scrub the claim, we submit the claim, we post the claim, we handle any denials, we send out any statements directly from TrackNet. So it's cutting down all that time that's involved in getting and shuffling all that paper from your office to another location. And the biggest thing that I like to say in talking about transparency is when you're using an outside billing company that's not NEMO Health, you don't know what's going on. You can't see any of your claims. You can't tell what's your account receivables. You can't see what might be anything that's going on from a financial standpoint because it's not being done in your system. Because it's being done elsewhere, it's up to the other company to get that information to you in order to see where you are at any moment in time. So again, time is money, making sure we cut down the amount of time that claims are hanging out there, not getting submitted. We talk about the cycle time of a claim and making sure that claim gets out on time is so vitally important because we all know insurance companies like to stall. We like to make certain that we give them all of our claims in the most timely fashion to get them processed as quickly as possible, because as one of the things that we all know, that cash is king. We need our cash to run our practices to provide the good quality care that we like to provide to our patients. John?
Mm-hmm.
So is your billing company actively involved in your practice? Like I said earlier, what are they doing for you? Are they just pushing a button and sending out those claims? Or are they actively involved in what is going on in your practice? Or are they just helping you adjudicate claims? There's a lot more that we at NEMO Billing do for you, and we're going to come back to that in a little bit and talk a little bit more about what we do from a consulting standpoint as a billing company that's going to help you in your practice. One of the biggest things that we also do is we fight for your money. Now, we talked earlier about those low-hanging fruit claims. Well, those are the easy ones. One of the things that we have implemented is a very unique 4-step appeals process. And one of the most unique things that we do is the fourth one, is we as a billing company use the consultants, both Dr. Juliana and myself, that if a claim is not paid, and we feel after discussing it with the doctor that this claim we think should really be paid for you, we will go to bat on your behalf. That a physician-to-physician, peer-to-peer consultative phone call will be held on your behalf between ourselves and the medical director of that insurance carrier in order to get that claim paid for you. Now, we're not going to do that if we truly feel that that claim was denied correctly, but if we feel that that claim should be adjudicated in your favor, we're going to go to bat for you all the way to calling and requesting to speak to the medical director on your behalf. John?
Sure. I'll take over for a moment here, Alan. As we drill down to the benefits of NEMO billing, we need to talk a little bit about cash flow, and we need to talk a little bit about understanding whether or not you doing billing within your own practice represents a strength or a weakness. And as Alan alluded to a moment ago, the single most important fundamental of your practice is your cash flow. Without cash flow, you are simply out of business. The moment you cannot pay your payroll, you are by definition out of business because you can't write IOUs to your employees. It's illegal. So the cash flow is determined by how you manage your account receivables. And that's where podiatry-specific experts come in. They understand coding. They understand correct coding initiatives. They understand the modifiers associated with the unique billing entity of podiatry. Some specialties are very easy to bill, but podiatry is a little bit more complex. Specifically, the billers of NEMO billing are all podiatry experts. They know how to govern your account receivables. You know, the fact is, the longer it takes a claim to get paid, the more likely it is that it will never get paid. A claim that's out there 30 days statistically has almost a 90% chance of getting paid. When it reaches 120 days, the possibility of that claim getting paid is almost reduced in half. So you are up against a clock of statistics here, and that's where they're experts. Typically, a podiatry practice will have 5 common reasons for claim denials. And in order, they are improper demographics as number 1, Wrong insurance as number two. Patients change insurance so frequently. Hopefully, whether you outsource to NEMO billing or you're doing billing in-house, hopefully you are using the integrated patient eligibility feature within TrackNet, because neither improper demographics or wrong insurance should ever happen if you're using the integrated patient eligibility feature, which tells you on your scheduler whether or not you have the proper demographics and the proper insurance on each of those patients. It'll be a green check mark, and it will tell you what the copay is of that patient. It will tell you what the deductible is. It will tell you what the remaining portion of that deductible is, all in real time. So number one and number two should be extremely rare. The third reason for denials is untimely submission. Many carriers have reduced their time frame of submitting. Some carriers are as low as 90 days. And if a claim is sent beyond 90 days, it's going to automatically be denied. And even if you've sent the claim in within 90 days, if a portion of that claim has to be appealed or the entire claim has to be appealed, you have 90 days to do that as well, or you lose the opportunity to appeal. So while Medicare is a year, many other carriers are now 90 days, 180 days. So untimely submissions are escalating. Correct coding initiatives is the fourth reason for denials. Not understanding the complexity of assigning the right ICD-10 code to the right CPT code. Not understanding what two procedures can be billed together, or are they bundled. All of those things are governed by a team of experts. And then the last reason is something completely out of our control. We know insurance carriers like to stall all the time, and they try to hold your money as long as you can, where they like to deny for no reason. They may tell you that the hammer toe procedure that you did is an integral part of the bunion surgery, and we know that's ridiculous. And that's where, as Alan said, the consultants get involved, and I'll get a medical director on the phone, and I will give that medical director an anatomy lesson. And typically, they have a much more difficult time arguing and defending themselves faced against a physician than they do with a biller or an office staff. So that's the fourth level of appeal that often gets claims paid. How do you know whether or not your revenue cycle management is a strength or a weakness within your practice? Well, let me share with you some of the benchmarks that we use at NEMO Billing that provide you with a report card. And on top of that report card, you are providing a monthly comprehensive analysis of your practice. Alan will talk about that shortly to show you how you're measuring up even amongst your 2,000 fellow podiatrists who use TrackNet. So you really begin to understand the strengths and the weaknesses of your practice. That's why our billing company helps you improve your entire practice. We don't just do revenue cycle management. Our goal is to help you improve your entire practice. So what benchmarks are we looking at? First, I'm looking at your total AR. And to me, your total AR, the money's owed to you by your patients and third-party payers, should never be more than what you charge out over 2 months. So if you're charging out $50,000 per month, your total AR shouldn't climb to more than $100,000. Separately, I'll look at your aged claim portion of your account receivable report, meaning those claims that are aged greater than 90 days. We naturally want them to be very little. I don't like to see, and we work very hard to keep aged claims at less than 20% of account receivables. Now, it's important to understand that sometimes these benchmarks can't be met because we are not given the opportunity or the authority to keep that AR report pristine. What do I mean by that? Well, some doctors don't like to write off monies that we know should be written off. We know that contractually they can never be paid. Some doctors have patients on their AR report that have been dead for 10 years who still owe the practice money. We know those are uncollectible. In those instances, we often see these benchmarks being missed. But in a pristine AR report, your claims over 90 days should not be more than 20% of your AR. I also, and this is a very important benchmark, I like to know what you're collecting versus what you're charging on a net basis, not on a gross basis. You see, a collection ratio on a gross basis is meaningless. If you charge out $20,000 for a first metatarsal head osteotomy, your gross collection ratio is going to be very low, simply because your fees are so very high. I use net collection ratio, and what I do with net collection ratio is I add back the contractually obligated adjustments. So I take your collections and I add your contractually obligated adjustments. I divide that by your charges, multiply it by 100. That's your net collection ratio. And your net collection ratio should be greater than 95%. That's the benchmark we use at NEMO Billing. I'm also monitoring your days in receivables. This is something we monitor over a long window of time. You can't do it really monthly. It shouldn't even be done in less than 6-month intervals. But your days in receivables tells me how many days it's taking for your average claim to get paid across all your carriers. We know some are quick, some are longer. It's simply your total AR divided by your gross charges for the year, multiply that number by 360 days. That should tell you how long it's taking your average claim to get paid. That should be less than 45 days for the typical podiatry practice. Now, you might be longer than that if you have a payer mix that's out of the ordinary. That's okay, as long as you can explain why it's longer, and as long as, if you go back historically, you've always had that long of a days in receivables, and all of a sudden you're not seeing a spike in your days in receivables. A spike would indicate a problem, a bottleneck within your revenue cycle management. I'm always looking at first pass denial rate. What's first pass denial rate? Well, after the claim is scrubbed, your biller scrubs the claim but then sends it off to the clearinghouse. How many of those claims by percentage are immediately kicked back by the clearinghouse? The reason, again, improper demographics and wrong insurance. If you're using eligibility feature software, you should be way less than 3% on that first pass denial rate. Alan, let's go back to talking about how we roll consulting into revenue cycle management to really actively get involved in your practice as another big point of differentiation for NEMO Billing versus other billing companies.
Sure. Thanks, John. So as we said earlier, billing companies, there are hundreds of them, thousands of them, and they can all push paper and they can all push buttons and they can all adjudicate claims. But really, what can we do to help you work smarter, not harder, help you make your practice more profitable? So one of the things that I do on a monthly basis is I produce a report for each and every one of our billing clients called a virtual practice optimization analysis. What it is a SWOT analysis. It looks at your strengths, your weaknesses, some missed opportunities that you might have in your practice. I look at the trends. I look at your patient trends. I see where you might have a blip in your new patients and what's going on. And we do a quarterly coaching call with each and every one of our clients to discuss what we find on this VPO or virtual practice optimization report. We look at your utilization data. We look at how your data is being used across. So, for instance, we'll look at at-risk foot care, and we'll look at the coding, and we look at how you're using 11.7.21 versus 11.7.20 and 11.7.19. Because we know by looking at these numbers and comparing them to the other 2,000 plus TrackNet users, what your data should be looking like. We do comparative analyses to see, are you an outlier? Are you more, as we talk about, more than 2 standard deviations away from the norm, to see if the numbers that you have within your practice or the trends within your practice will raise the red flags for an audit. So we look at that each and every month. And lastly, one of the things that I do more than anything else is I help guide all of our billing clients complimentary through MIPS, through the quality payment program. Because one of the things that we do not want, number one, we do not want a penalty for any of our clients. Number two, we want to guide you so you can get an incentive more than anything else. That's what is the differentiating factor between our billing company that rolls out consulting along with all of the other billing processes that we do. John? So again, our billing company is wrapped around a lot of different things. So number one, becoming a billing client, we would bring you to our cloud-based electronic program, which is now one of the very few that is 2015 ONC certified. Of the top 12 or 13 of the ONC certified softwares, we are the only podiatry specific EHR, right behind all of the big boys, the Epics and the Allscripts. Our billing company is all podiatry specific. Our billers are only doing podiatry coding. They deal with the LCDs and everything that needs to be done in podiatry. That's all they do. As John said earlier, it's a complete revenue cycle, from the scrubbing of the claim all the way through to the sending of the statements to your patients. We handle everything, and it's done in real time. That's the biggest thing. We want to get those claims scrubbed, sent, and we want that money in your bank account and out from the insurance company's bank account. And one of the things that we like to call ourselves, NEMO Health, we call ourselves a practice improvement company. We don't call ourselves an EHR company. We don't call ourselves a billing company. We wrap that all around our consulting and all the other things that we have, and we call ourselves a practice improvement company. We want to help you improve your practice. So making the move over to NEMO Billing and NEMO Health in general is very, very easy. One of the things, as John said, we can provide for you is to show you all the hidden numbers in what is it costing you to do your billing in your practice. We can do a complimentary billing profit analysis where we will get some information from you in order to truly show you what it is costing you to do your billing in-house as opposed to outsourcing to NEMO Billing. By outsourcing to NEMO Billing, there is a more than likely chance that the price that you're going to pay us to do your billing is going to be inclusive of your subscription fee to utilize, or your license fee to utilize TrackNet. There won't be any additional fees to use the software. If you're currently a TrackNet user and you're functioning on a server within your office, we will move you over to our TrackNet Cloud complimentary in order to be able to do your billing for you more efficiently. We'll bring you on. We will onboard you and handle all of switching everything that you need over from your old billing company over to us. One of the things that we do talk with you about is winding down your old accounts receivable in your old billing system. It's one of the things that we don't do. We like to start fresh. So we're going to bring you on to the TrackNet and NEMO billing family, and we're going to go through our initiation and onboarding, and you're going to be winding down your claims and even still sending claims in your old system. But then when the day starts, everything goes out through TrackNet. So there's really no downtime in any of the cash flow within your practice, because on a certain day, we're going to flip that switch and we're going to start all that billing for you. John?
Great, Alan.
Nope. Why don't you finish up? Go ahead.
So all I was going to suggest is that we reemphasize that if we've sparked any interest here, if you think you might have some weaknesses in your revenue cycle, it starts with what we're offering you, which is the complementary billing profit analysis. I will show you mathematically by asking you certain questions, getting certain data from you, what exactly it's costing you right now to do revenue cycle management within your practice. And then I will show you the comparison of what it would cost you to outsource, and you'll see the net results of that. Some of the net results are astronomical, some are smaller than others. And as a consultant, I'm happy to have those discussions with you to help you make the most prudent decisions for your practice. Simply contact sales@nemohealth.com, and we would be delighted to provide you with that billing profit analysis. Before I end, Alan, are there any closing thoughts from you?
No, the only thought I really have is I think that when you truly compare what we have as a billing company, inclusive of all of the consulting that we offer, I think that's going to show truly the NEMO advantage and the NEMO billing advantage over the other billing companies. So if you're doing a really good analysis of what other companies have versus what we have, I think you'll see bringing your billing over to NEMO billing will be the right move.
Yep. So I have a question that I'd like to answer here. And the question is, do I have a point person or a contact person as my account representative if I use NEMO billing? The answer is yes. You have what is known as a senior billing administrator that connects with you on a phone call on demand. There's often a weekly call that's set up just to go over accounts. There's constant communication with your practice through the tasking feature of TrackNet. But realize what I talked about before, the flexibility of labor. Not only do you have a senior billing administrator that you're in direct contact with, but that senior billing administrator also has a team below them. Some who are account receivable specialists, some who are appeal specialists, the things that you can't possibly provide as resources within your own practice. And if you can provide it, it's coming at a very, very large opportunity cost because you're giving up something else to be able to provide those resources. Another question is, did I miss the cost? Is it a percent of collections? Yes, it winds up to be a percent of collections. The cost is something that is very unique to each practice. That's what the billing profit analysis will help drive. As we get data from you, we customize the price. We actually enter data into an algorithm, and we come up with a very economical but unique price. It could extend anywhere from, depending upon your data, just to give you a ballpark, anywhere from 5.75% of your collections up to 7.5%, 8% of your collections, depending upon the size of your practice, number of claims, and it's all driven by an algorithm. That includes, remember though, when you outsource, very typically the cost of your EHR disappears. The cost of your backups that you may be paying monthly to have backups performed disappears because all of that's done on the cloud, and TrackNet is provided to you without that monthly subscription fee. So please contact us and we'll give you the exact cost for your unique practice. I don't see any more questions, Alan. So with that, we're going to adjourn. We hope you've got some great information out of this webinar on how we look at revenue cycle management. Please don't hesitate to reach out to us anytime. Alan, thank you so much for joining me tonight. You're welcome. And everybody have a wonderful evening.
Good night.
Good night.